Watching the Medical Class 901 with Dr. Chi. Dr. Chi MD is a renowned infectious disease specialist in the Memphis community. Without further ado, let's join the Medical Class with Dr. Chi MD.
Absolutely. Thank you, Betty, for having me. My name is Dr. Chinelo Animalu, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine.
Okay, now, I always ask the doctors when they join me, why is your passion, or why was your passion to go into your field of study, infectious diseases? I'm always curious about that.
Yeah, so as you know, infectious disease is a specialty that basically deals with managing or treating various types of infections. It could be bacterial, it could be viruses, it could be fungal.
Let's talk about since you're an expert in this, let's talk about some other diseases that we may not hear about a lot, but they're out here.
So another disease to consider would be syphilis.
It's back, or has it never went away?
So we thought we were on the path to complete eradication, but it's done a rapid turnaround, so we are back to syphilis areas again. Yeah. So syphilis, just like HIV, would be, considered a sexually transmitted infection, and it was rampant, in those days. And there was a lot of effort by the government, the CDC, the World Health Organization, UNICEF. People came to, do everything possible to have this infection eradicated, but it's made a major comeback. Mm-hmm. So just the same way we have seen an increase in HIV, especially in our community here in Memphis, we've also seen a major rise in syphilis amongst our members here. And so it kind of boils down to the same thing. What do we do? So right now, we are not only worried about HIV, we are worried about syphilis, we are worried about herpes. There's so much, to talk about, but part of what we do is to also educate our communities to kind of watch out for these things.
So I know this is probably a question that I just want to ask because you're an expert here. Why is it always somehow connected with sexual activity? Is it because of body fluids, or is just something that it's just a sin in this one way, the consequences of it? So seriously, why?
Okay, so those will be considered, so the infections I just mentioned will fall under the class of STIs, that sexually transmitted. Okay. But I promise you, we have a whole lot of infections that has nothing to do with
But in our community, we're talking about these because we need to bring awareness.
Yes, and we are seeing this amongst our younger generation. And as a parent, I have kids in college, I have kids in high school, and that's the age range that is worse right now. And also, when you talk about race, it's worse in the African American community. So it's something that's very passionate, to me. And I feel like part of what we're seeing is lack of education. I took the liberty of talking to a few high school kids, and I just kind of wanted to see what they knew about HIV. I say, what do you do? And they were like, you take antibiotics. And I almost passed out. No, man, you cannot take antibiotics. It's a virus, not a bacterial. So it became very clear to me that our communities are not well informed, well educated, and I feel it's part of what we do to kind of steer them in the right direction.
So what do you think would be a good approach to bring awareness to young people, especially being that they're being affected by it, right, in high numbers? So what do you think? What do you think we can do as a community or the media to help young people? Do they not have health in schools or where they can learn, or have someone like you to come in and, do some kind of outreach to them? Because this is important.
Absolutely.
It's a life or death here.
Yeah, so it's a life or death situation here. And part of what we're doing right now is the major hospitals or healthcare providers in this city. I work for Methodist and for UT, and we are all coming together to work with the health department, Shelby County Health Department, and see what we can do. We are more than happy to go into schools and educate our young kids. Because, like I said, part of what we're seeing is lack of education or misinformation. So to be able to create this awareness, because this is something that nobody thinks about, till you find yourself in the hospital, and then, the doctors are like, oh, okay, you're HIV positive. You're like, wait, how? How did this happen?
Right.
My name is Dr. Chinelo Animalu, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine.